Good morning, everybody. Welcome to Facial Plastics Friday. It's Dr. Brace here, and today we're going to continue on with facelift complications. So last week, if you go back and look, I talked about a hematoma being bleeding under the skin, and that can happen from any surgery. In a facelift, it can be particularly distressing or dangerous if there's pressure on the airway. Today, I wanted to talk about scars or incisions and sutures, because one of the most common phone calls we get after facelift surgery is, I came in at a week to have my sutures removed, but there's still stitches there. I think you missed them. And there are two different types of sutures that we use in a facelift surgery, and some of them are meant to come out at the 1 week mark, but some of them are not. And there's a reason for that. And so the incision, as I've mentioned before, for facelift goes along the hairline, up kind of behind the sideburn hair, down in front of the ear where the ear and the cheek meet, behind the tragus, in front of the earlobe, and then wraps around the ear, comes in behind the ear in the crease, and then back towards the hairline and down the hairline of variable degree. There are little blue stitches here that come out. Those are called Prolene, and they are a non-absorbable synthetic material. Prolene has the nice quality that when you work with it, it's very, very smooth. It glides through tissues easily. It has a very low chance of creating a train track effect. And so I put little tiny 6O prolenes in the skin, and those are the ones that you have removed at 1 week. Underneath your skin, though, underneath those prolenes in the deep layer of the skin, there is monocryl, and that's a monofilament absorbable synthetic suture that is meant to dissolve. It can take a few months for that to dissolve. And so one of the calls we often get is, I think I have an infection, I think I have a complication with my incision, there's a little white stitch or clear stitch, looks like fishing line coming through my skin. That's a dissolving stitch that, instead of dissolving, your body is pushing out, and that's totally fine, totally normal. It will come out, it will fall out, the skin will heal up, and you're not left with any long-term blemish or anything from that incision. The other suture that I use, right in front of the ear and then right behind the ear in two spots, so there's three of them on each side, is called a Vicryl. A Vicryl suture is a braided synthetic absorbable suture, so it's very tough, very strong. It also takes months to dissolve, and I put that there as a tension stitch or as a security stitch to hold the skin in place at the points of fixation before I do the skin trimming. So when the skin gets redraped, I fix it in front of and behind the ear, and then trim the skin so that there's no tension, so it sits nice and flush and it's not going to widen. But those I leave in for the first month. I leave them in there because often when you take the blue stitches out at 1 week, it tends to want to gape or pull there because of the weight of the swelling in the face. And so these are not missed. They're there for a reason. They stay in for a month. At the 1 month appointment, I take them out, or they've already fallen out by that time. That stitch is also present where your earlobe reattaches to the cheek. So that incision will go around the earlobe here. And when I'm redraping the skin and recontouring it, I will anchor the skin to the deep tissues below your earlobe with a Vicryl stitch. And I want it in there, again, as a sturdy anchor so that you don't end up with a pixie ear or your ear pulling down. And so sometimes that doesn't dissolve and it actually spits out. So you might have a little bundle of kind of white looking suture that comes out. And that is one of the consequences of a dissolving stitch, where it doesn't dissolve, but your body basically expels it out of the skin. The last type of stitch that we have, which is different again from the other three I talked about, is a chromic gut suture or a gut suture, and that's in behind your ear and along your hairline. I put those sutures there because they dissolve quickly, usually in the first 2 weeks. And I put them there so that I don't hurt you when I'm trying to pull sutures out from behind your ear, because you're swollen, you're tender. I don't want to be pulling your ear forward and trying to pick stitches out of the crease back there, or Nurse Jocelyn doing that. And so we put dissolvable sutures because they're gone within usually 2 to 3 weeks. They fall out, there's no pain involved. They do their job. And back there, even if there's a little bit of persistent redness in behind your ear in that crease, nobody sees it, nobody is going to be worried about it. And so that's why we use those there. So it's not so much a complication of facelift, but sutures do sometimes not dissolve and they get expelled. It's a normal part of the healing process. If you've had a facelift with us or with someone else and you notice clear or white suture material or strings that look like fishing line coming out from under your skin, and you're within the first 3 months of healing, that's a dissolving stitch that's making its way out. Let your surgeon know. If it's sticking out and it's bugging you and it feels like a little whisker, it can be trimmed or removed in the office, but for the most part they can be just left to dissolve and fall out. So send us your facelift questions if you have any. Everybody have a great weekend. Happy Facial Plastics Friday.